Denture solutions and beyond. Welcome to Image Dental Laboratory. It's come to our attention that you made the decision to get back to that place where you were when you had the look and feel of your natural teeth. The aesthetics, confidence and chewing capability that you may have lost years ago will be the main focus of this video, where we discuss the options available to you to restore your smile to its former self, or even better, with an entirely new look to complement the new you. Before we jump into it, here's a little something about our lab. Image Dental is a state-of-the-art laboratory with more computers, scanners and 3D printers that we ever could have imagined 6 or 7 years ago. We are amongst the most technologically advanced dental laboratories in Ontario, and we are the lab that your doctors have chosen to restore your smile. Our real secret though lies in the people that work here. You see, we have a truly international team of trained technicians who are excited to work on your case to help restore that perfect smile. This video has been developed in close collaboration with Gord McDowell, our very own implant and removables consultant, who has over 40 years of experience in the industry, and our goal with this is to introduce the myriad denture restoration options available to you beyond just conventional dentures. Let's get started. Today you may find yourself already having dentures. Whether it be only on top, bottom or a full set of upper and lower dentures. You may like the look and feel of your dentures, but we all know that they wear down and become uncomfortable over time as bone resorption occurs in our mouth. This results in loose-fitting dentures and pose a real onslaught of problems down the line. There are temporary solutions like denture adhesive that you can buy off the shelf to help mitigate the struggle of loose-fitting dentures. But that's exactly what it is. It's temporary and sometimes just downright yucky. Might as well apply peanut butter, at least it will taste good. So here you are today. You want to take it a step further and beyond your normal dentures. What are the options? In terms of the most cost-effective option, we can start off by adding what we call Locator Abutments to your dentures. When going this route, we manufacture a new set of dentures where we place nylon clip-on components in your denture, which snaps onto a corresponding implant component in your mouth. This implant component is placed surgically by your dental provider and helps to substantially improve the retention or grip of your dentures. With this option, you can willingly remove the dentures for cleaning and sleeping, as we don't recommend sleeping with dentures anyway, because we also don't go to bed with our shoes on, eh? We normally place at least 2 locators for lower dentures and 4 locators for upper dentures, but it may differ depending on your situation. Let's talk pros and cons for this option. Pros first. With Locator Abutments, your dentures will be more stable in the mouth as it is held firmly in place, and it saves you the embarrassment of having loose dentures that falls out all the time. It also holds your dentures in place for better functionality and completely eliminates the need to apply that yucky over-the-counter denture adhesive material. The dentures can be readily removed at any time for convenient cleaning, and with upper dentures we can also remove the material that covers the palate to improve the sensation of eating food. Having a palateless denture will help you taste your food better. What are the cons? In respect that this option is a substantial improvement over just conventional dentures, it's not without fault. Hence, the cons are far less substantial, and there are just a few minorities to address here. With this option, especially when going with only 2 locator abutments, you may find that the dentures has a slight rocking effect when forces are applied to it. Again, this is a minor setback and can easily be corrected by placing more locator abutments. Another con is that these nylon clip-on inserts do wear over time and will result in a denture that rocks more. Luckily, these nylon clip-ons can easily be replaced by your dental provider. It's just a quick visit and you're all back in business. In short, this option needs some servicing, and depending on your own personal situation, they may need to be replaced every 6 months or so. Some patients go years without replacing the nylon components. Another con would be that your denture can still break, just as your old conventional denture, because there's no substructure to reinforce it. But don't worry, broken dentures can be repaired even if they have implant components in them. Moving on, let's say you have a little more money to spend. Not a whole lot more, but you want the next best thing. What option is available beyond what we have just discussed? As with the previous option where your dental provider placed implant components in your mouth, This option also takes advantage of having multi-unit components implanted into your bone structure to help with denture strength and rigidity. For this option, we are introducing the All-on-4, and for this, we are skipping the technical talk because all you have to know is that it's primarily a denture held into position by 4 implant components, hence the name All-on-4. What separates this option from the previous is that where the previous option could be willingly removed and held in position by nylon clip-ons, this option is more permanent and the denture is firmly screwed onto the corresponding implant components in your mouth. The All-on-4 is a more permanent solution with no palatal coverage, which means you can taste your food better. And the major advantage of this option over the previous is the fact that it's even more stable in the mouth. No rocking effect with this. The core of the All-on-4 denture is also much stronger because it's reinforced and embedded with a solid and rigid milled titanium bar that runs the full length of the denture arch. And you won't break this as it's recommended for patients with stronger bite forces. What are the advantages? It's a more permanent solution and doesn't have to be removed from the mouth. It's strong, rigid and stays firmly in place without the risk of falling out. There's also no rocking effect as what you would get from the previous option. What are the disadvantages? Even though the core is strong and made of metal, the teeth are not. The teeth are still made of acrylic plastic the same way your conventional denture was made, and it will wear over time. Luckily, should the time come to get a new set, you don't have to endure the cost of having to make a new titanium bar with a new set of teeth. We simply strip the acrylic teeth from the bar and replace them with new teeth and you're good to go. Okay, these are great options, but can we go further? What's beyond the All-on-4? Do we have a Rolls-Royce option? We have a solution for you even beyond the All-on-4, but not nearly as expensive as a Rolls-Royce though. With this option, we are moving away from acrylic plastic teeth and we enter the realm of ceramics. Here, we have options within the option because we can manufacture porcelain teeth reinforced with metal substructures, or we can go completely metal-free with zirconia. However it may be, and depending on what best suits your personal needs and circumstances, we can restore what you have lost years ago and recreate that perfect smile. The beauty of this option is that we can manufacture your teeth in a way to mimic the perfect natural dentition, and each individual tooth can be characterized to make it look even more natural. With this option, we mill a full zirconia arch, and again, there are options within the option, variations and a lot of configurations, all to be discussed between you, your dental provider and the laboratory, but for the purpose of this video, we demonstrate it with this solid milled zirconia arch with some single crowns to demonstrate some variation. It all depends on your preference in conjunction with what is possible with your current situation. When manufacturing these crowns, we cut them with ceramic material to make them look more lifelike, and because they are a zirconia based product, it's extremely strong, durable and doesn't wear down as acrylic teeth do, and they don't break as easily as acrylic teeth do. The entire unit or subframe is fixed permanently in the mouth, also screwed down onto multi-unit implant components the same way as the All-on-4. This can be configured in one solid milled product, or individual crowns can be manufactured as demonstrated here, which then will be cemented into place. What are the pros? This is the closest you will ever get to having a natural looking smile to restore or even improve what you have lost years ago. The advantage of having single crowns as demonstrated here is that if you have an accident where you chip a tooth or something breaks, your dental provider fixes it temporarily while we pull up your file, manufacture and replace only that one crown, and you're all set. Cons? Apart from this being the most expensive option, yet an extremely good investment, there are no real disadvantages to consider here. Depending on your own cleaning capabilities, you may have to go to your dental provider to unscrew and clean the restoration on the contact areas every 6 months or so. That's it. Options can sometimes be overwhelming, or just the mere fact that we simply don't know what options or solutions are out there. This may keep us from ever achieving our desired smile. But now you know. If you are struggling with conventional dentures and all the embarrassment that goes with it, Image Dental Laboratory will take your smile beyond your expectations.